right, great. Can you go ahead and just tell me your first and last name so I have the
Well,
pronunciation?
my name is Carmelita, last name Thomas.
Okay, great. Now, what program did you participate in? Was it the CNA or home health aide?
Both home health aide, and then it was just better for me to do CNA as well.
Okay, great. How long was each program for you?
Oh, with COVID-19, it took about 6 months.
Okay, to complete both.
Yes, ma'am.
Okay. So, what are some of the key takeaways that you've learned from taking the programs?
The number one thing I would say is being a team player. Because that's important. If everybody isn't on the same page, especially when it comes to our patients, that's the number one thing. But also out of that, just the many different things we had to learn, like blood pressure cuffs, something that I was always interested in and wondered, how does that work? Learning how to speak and read what's written medically. Oh, that's important because then I can read my own doctor's notes.
Yeah, that's great.
So
Okay. So, where are you working now?
actually, I am with a private family here in Quincy. So it opened an opportunity for me to, I'm just really grateful.
So, what advice would you give someone who is considering the Gadsden Connect program and maybe a bit hesitant or nervous about it?
Oh my goodness. Just as I was nervous, it is a vast opportunity that they do not need to pass up. The learning and the hands-on experience, I would give it a 10 plus, but the teachers are very dedicated to each and every student. They help us with everything we need to learn, extra help, extracurricular activities that will, where you may have a shortfall in, it allows you to go in and continue until you are sure of what you're doing in order to pass that state exam.
Okay, great. And touching on what you mentioned, the state exam, how was that? Did you feel prepared going through that? What was the timeline for you?
Oh, I was confident. It just took forever to get an exam, but you have to look up the various exam places here in Florida or wherever you want to take it, because you have the opportunity to take it where it's most comfortable for you. And I went in confident. I went in sure. I was ready. I was anxious. I was excited. That's a state license to hold, and it's an honor and a privilege to get one. And TTC helped me do that.
Great. Now, I know you were on a scholarship because through the partnership, Sunshine Health provided full scholarships.
Yes.
So, what would
Yes.
you like to say to those partners, to Sunshine Health, providing a scholarship?
I thank you. I thank you. I thank you. And I hope that this program continues because it is such a wonderful asset here in Gadsden County. And right now we need as many first responders as we can get. So I thank you.
Well said. Is there anything else that you would like to add that I didn't touch on?
I would like some of the students to understand that nursing is a position where you have to care as well as love what you're doing. So, you at TCC, the training that I got was well worth and over my nervousness, but it was well worth the program to get into. So don't have any fear. Just go ahead, jump in it because they have the instructors that are there for you to help you. And where you think you're not strong, they'll help make you strong.
Okay, great. So what's next for you? Do you plan on working in private healthcare, or do you want to pursue more schooling, or are you just kind of enjoying right now?
Oh, thanks to Sunshine Health, now I want to go higher. The opportunity at TCC is there also for me to go into LPN and just, I love the medical field. So I'm sticking with TCC and see about increasing my knowledge and my skills.
Great.
That's what's next for me, LPN.
All right. Thank you so much. I'm good.